Facility fees are often used by hospitals to maximize revenue by covering operating and staffing costs in addition to professional service fees. Facility fees for care provided via telehealth when the patient never sets foot in a facility are very hard to justify. Additionally, the imposition of facility fees can significantly increase out-of-pocket costs for patients, leading to higher premiums and overall spending. This creates an added financial burden on consumers and can cost as much as $1,000. There is often little transparency regarding when and how hospitals charge facility fees. Patients are frequently unaware of these costs until after receiving care, leaving them surprised by unexpected charges. As we know, Democrats have worked tirelessly to bring down the cost of health care for average Americans. In the Inflation Reduction Act, Democrats made changes to improve drug affordability for seniors and people with disabilities who rely on Medicare Part D. Democrats capped the cost of insulin at $35 a month for seniors. Democrats extended enhanced financial help for those purchasing plans on the ACA marketplace, saving enrollees money on their premiums. Additionally, the bipartisan infrastructure law was the largest internet affordability program in the history of this nation, helping 23 million households save $30 to $75 on their monthly internet bills and bringing affordability, reliable high-speed internet, and accessibility into underserved communities. As we modernize delivery of care, we must also appropriately adjust for billing. While I appreciate my colleague for introducing the Transparent Telehealth Bills Act to address the issue of facility fees, I fear the most important person has been forgotten altogether: the patient. Patients are often charged separate cost sharing for both the professional services and the facility fees. If we are going to do some work on this, we have to make sure we are addressing the patient. This results in consumers receiving double bills, so even when a patient sees a doctor who is in their network, they will still be exposed to facility fees. And when consumers receive care from an out-of-network provider, they often receive a separate balance bill for the amount not covered by their plan. This includes the facility fee. This bill does not address these situations and therefore does not protect consumers from the cost of the facility fees. My amendment would address both situations by preventing healthcare facilities from charging consumers a separate facility fee. Under my amendment, facility fees for telehealth would only be permitted when there is no professional fee available to the billing provider. This approach is fair to healthcare providers who will get paid for their services and to patients who will only receive one bill for the care they receive through telehealth. While it would have been more fruitful to have had more time to work together on this legislation to get this important policy right, I believe that my amendment will greatly improve the bill by doing what the underlying text fails to do and protecting consumers from unnecessary facility fees. I urge my colleagues to support this amendment, and I yield back.